Hi everyone, I'm Heather. I am one of the speech and language pathologists working with Great Speech. Today I'm going to be talking to you about adolescent and adult fluency strategies. So I'm going to share with you a short PowerPoint just talking about all of the different strategies that you can utilize when you're practicing at home on your own. So I am gearing this PowerPoint towards people who have children who are 12 and older, as well as adults. So there's a little bit of overlap here. So most of you who are watching this video are probably already aware of the core behaviors of stuttering, those sound and syllable repetitions, whole word repetitions, the prolongations, and the blocks where it's difficult to get the sound out. Some secondary behaviors include those head nods, eye blinks, foot taps, jaw tremors, and that visible struggle that you can have with your muscles in your neck and in your face. People who stutter often avoid or maybe substitute a word that they're having difficulty producing. You might hear unfilled pauses or frequently used interjections. These are just some general tips for parents of adolescents, or that as an adult you can share with the people that you love as tips for what helps you. So paying more attention to the message itself and the delivery of the message. So making sure that you're using your facial expressions, your tone of voice, your body language to show that you're listening. I've often heard people tell me that trying to finish your sentences or maybe guess at what you're going to say isn't always helpful. Simplistic advice is the same. Things like just slow down or try to relax. So our goal at this point for adolescent and adult stuttering is management and successful communication. So what we as speech therapists are looking at are things like just decreasing the severity of the stuttering, increasing positive speech attitudes, decreasing concern from familiar people, and decreasing the overall functional impact. So the first technique that we're going to be talking about is the stretched syllable technique. So this helps to reduce your rate of speech and it allows you to perceive changes needed to speak more fluently. It helps you focus a little bit more on each of the sounds themselves. So for this technique, you're breaking each word into syllables and you're stretching out each syllable in a word for 2 seconds with a light stretch on the first sound in each syllable. So an example word here is the word lightly. If you were to use the stretch syllable technique, it would sound like this: lightly. Now, there are some sounds that you can stretch and there are sounds that you cannot. So you'll find a list here of the sounds where that does work, and the sounds that don't work are those sounds that are short stops, they're explosive sounds. You can't really draw them out. On each of these pages, you'll find some activity ideas, and I've put a link here for some word lists that you can use and some sentences. The next technique is using diaphragmatic breathing, so making sure that you have enough air for fluent speech. So for this technique, really you want to be breathing with your diaphragm, that large muscle below your lungs, and not in your chest. So when you're practicing this, you should be able to feel your abdomen expanding and not your chest. The next technique is the passive airflow technique. So this is used to ease the beginning of sentences to start and keep them flowing gently. So this is where that diaphragmatic breath is really important, because you want to take a full deep breath before you begin, and then you're going to start letting the air out for a brief pause. And as you feel that passive exhale, your vocal folds are open, and this is the position that we want them to be in. And you start speaking by stretching the first stretchable sound for a full 2 seconds. So for this example, I like ice cream. So again, here are some activity ideas that you can use to practice this technique. The next technique is the gentle onset technique. So this one is very commonly used in fluency therapy. So this method is used to gain control over how abruptly your vocal folds are turning on. So people who stutter frequently have difficulty getting their vocal folds to start gently without causing that hard contact that sometimes sets off a stutter. So how you're going to do this is you're going to turn your voice on with the lowest, softest vibrations that you can make of your vocal folds. And you're going to smoothly increase the volume and strength of your voice to a normal speaking volume. And then you're going to decrease that volume and strength back to one of the lower, softer vibrations. So your vocal folds, they're housed in your larynx, which is right here. So if you put your hand on your throat, you should be able to feel your vocal folds vibrating. So if you need um, that contact with your throat to be able to feel the vibrations, that can be helpful for you potentially. So in this example, I'm going to use the sentence, I like ice cream, for all of these examples. So for this one, you could start with that I, and you're going to gently start your sentence. I like ice cream. The next technique is the continuous phonation technique. So you're keeping your voice turned on to reduce any opportunities for stuttering. So you're going to bring your attention to your larynx again, where your vocal folds are located. And your goal here is to keep your voice turned on as you are speaking. So there are some consonants where your voice is on and some where your voice is off. So the trick here is you're trying to get your vocal folds to stay on as long as possible so that you're not causing the stuttering to start up again. So in our example sentence, we would say it like this. I like ice cream. Light articulatory contacts is the next technique. So you're reducing the force and the pressure of your articulatory contacts when you're producing speech sounds. So this is a strategy where I would say work with your speech therapist to determine which sounds are giving you difficulty, and then your speech therapist can talk with you about how you produce each of those sounds. But in general, you're going to feel your mouth come into position to say a sound, and you're going to use as light touch as possible when you make the sound. So for example, in the sentence, I like ice cream, maybe you struggle with the K sound. So the K sound is produced in the back of your tongue, and you're going to try to use as light contact as possible as you say the sound. So I like ice cream versus I like ice cream. Progressive muscle relaxation is another really great strategy and also necessary for like the next three techniques. So it's teaching your brain how to let your muscles relax. So you're going to start with the muscles in your cheeks and jaw, and you can choose to do other muscles in your body as well. But you're going to tighten the muscles as hard as you can for 5 seconds, and then you're going to let all of that tension go and repeat this 5 times. So for the next three techniques, these are stuttering modification techniques, and they build upon each other, and they all utilize that muscle relaxation. So the cancellation technique, you're working on letting out tension, and then you're going to re-say the desired word more fluently. So how you do this is when you stutter on a word, you're going to stop and pause, release that tension, and try saying the word again while stretching out the difficult sound. So the example here would be, I like ice cream. Now for the pull-out technique, the difference here is that you're going to try to work through the sound. So you're going to say the word again while stretching out the problem sound and keep speaking. So I like ice cream. Now for preparatory sets, this is technically the hardest of the three because it requires you to be aware enough of your speech that you know what words you might stutter on. So if a word is coming up that you know you will stutter on, you're going to bring your attention to the area in your mouth or throat where you know that tension will happen. And when you get to that word, you're going to make the problem sound with less tension than you normally would and stretch out that sound. So for this, you're kind of using a lot of different strategies at once. So for the example, you know you're going to get stuck on the word cream because of the K sound. So as you say that sound, you're going to give it light contact and you're going to stretch it out. I like ice cream. Communication attitudes and feelings are another important area that we look at when we're looking at therapy. So the voluntary stuttering technique is used to practice when you need to practice at home and maybe you're not stuttering at that time, but you still want to practice your strategies. But it's also for exposure therapy, so desensitizing yourself to the feelings of stuttering. It gives you that sense of control over your speech. Self-advertisement technique is coming up with a sentence or something that you want to say to share that you stutter, and you might during a conversation. It's used just to reduce any stress that you might be feeling, and it allows you to think and speak more clearly. Then, in that case, you're not worrying about what the other person might be thinking. The confident eye contact technique is used to build confidence and is another strategy for desensitization. For this technique, you want to make eye contact for about 3 seconds and then look away for 2 seconds. Now, for this strategy, it's probably best to start with somebody that you're familiar with. It would feel less awkward to start out that way. Support groups are always really great. They give you that sense of belonging and people who understand how you are feeling. Daily affirmations is another great way to work on positive self-talk. So just creating sentences like, I can do this. I know that I'm going to be okay in this situation. Anything that you can come up with personally that's meaningful to you. For references, so I highly recommend the Fluency School, the Ultimate How to Treat Stuttering package. The author is this SLP Steven. His website link is right here. He is a really great resource. He has a lot of different strategies and videos that you can look at. He also happens to be a speech therapist who stutters himself, so he has a lot of understanding on what it feels like and which strategies are useful. The NSA and the Stuttering Foundation have been around for a very long time, and they have a lot of really great resources. And then those bottom 3 links are support groups for adolescents. So those are the primary strategies and the strategies that I often use during speech therapy sessions with my clients. Just kind of a brief overview if you need an example or activity ideas or just a reminder on how to do the strategy. Hopefully you'll find that helpful, and as always, reach out to your speech therapist if you feel like you have questions or concerns. Thank you for listening. Bye.